Regional Hospice offers care to our patients in whatever setting they call home. This aspect of our care has allowed Regional Hospice to develop strong partnerships with the assisted living and skilled nursing facilities in our community. If the residents of these facilities become appropriate for hospice care, our staff works closely with the staff at these facilities. These partnerships have a very strong common goal: to offer the very best in end-of-life care so that these residents receive comfort, dignity, and respect.
Hello, I'm Michael Malone. I'm the Executive Vice President and one of the owners of Hancock Hall and Filosa for Nursing and Rehabilitation here in Danbury, Connecticut. Our organization has had a very positive, long-standing relationship with Regional Hospice. We've worked with them for as long as any of us can remember, probably since the inception of Regional Hospice. We've benefited a great deal from their services. They've been very effective at providing a service that really enhances the quality of life of their clients. I mean, we've seen that. That's always been our focus, and we've always felt that the practitioners from Regional are truly professional and truly focused on providing the best hospice service possible. And we look forward to their continued success and certainly continuing to work with them in the future.
Good afternoon, Bethel Healthcare Center. How may I help you?
I'm Lorraine Montello. I'm the supervisor of the Cascades Assisted Living at Bethel Healthcare Center.
And I'm Jane Lynch, and I'm Assistant Director of Nursing at Bethel Healthcare Center.
We're here today to discuss our very special relationship with Regional Hospice and how they coordinate their care with our nursing care here in the apartment building at the Cascades Assisted Living. Regional Hospice guides us through what we can do to support our resident.
We also have a very special relationship over at Bethel Healthcare with Regional Hospice. It's a long-standing relationship. They bring their expertise and their knowledge, which helps assist our nurses in the care for the patients in that time of life where they have chosen palliative, end-of-life, and comfort. And the different disciplines, the volunteers, the social workers, the nurses, the chaplain, they're invaluable to our facility.
Family members talk about the follow-up services of Regional Hospice and how they contact families at Christmas time, many months after our resident has passed away, and that Regional Hospice is still checking on the kids to see how they're coping, and it's not just in the moment, it's also many months past that families say they're not forgotten.
In addition to the nurses, home health aides, social workers, and spiritual care providers at Regional Hospice, volunteers are an important part of our team and make regular visits to these facilities, often developing very strong bonds.
As volunteers at Regional Hospice of Western Connecticut, there are many facets to what we do. We go into homes and sit with patients and allow the caregiver to have an afternoon off or a morning off and play cards with the patient or just watch TV, bring some Dunkin' coffee and just develop a friendship. And when we go back to the same home several times, we really become quite close as friends. But we also drive patients to the doctors, to the hospital, or just take the patients out for a ride. All the things you would want to do for a loved one or a friend. And in all cases, we love to get to know them better. We treat them with respect and reverence and love. In the skilled nursing facilities where we are today, for example, we come in here every week. So you see the same patients every week and you develop a deeper kind of friendship with these patients. And we get a chance to sit together and talk about current events and politics and sports and growing up, because many of them are in the same age bracket I am. So we remember the days of the Iceman and the outhouse. And we talk all about how things have changed and our careers and our hobbies and our families and our children. And we can get very close.
My name is Dr. Michael Tawai. I'm Medical Director at Danbury Healthcare Center, and I'm also the founder of Kevin's Community Center Free Clinic, and I have a private practice in Danbury. First of all, I'd like to take this opportunity to thank Regional Hospice and congratulate them on 25 years of exceptional service to the community. I know over the years I became a believer in a philosophy that's adopted by Regional Hospice, especially when it pertains to end-of-life issues and the very difficult issue of death and dying, in helping not only the patients transition, but also families as well. I know the nurses at Danbury Healthcare Center frequently tell me about the exceptional service provided by Regional Hospice and how happy families and patients are in receiving that service. We as medical professionals share a common goal, and Regional Hospice in particular provides a very important component in the overall healthcare delivery, in addressing variable issues, not the least of which is end-of-life issues, with all the spiritual, emotional, psychological, and medical components that accompany this problem. Of course, a very complex and a very difficult topic that I feel is mastered by Regional Hospice.